Good evening. This is episode 10 of Injustice for All with Just Joe Brown. And I am the moderator, the real Dana. So tonight we are going to be talking about Obamacare. Yes, March 23rd, 2025 marks the 15th year that Affordable Care Act came into effect. The Affordable Care Act was signed into law by President Obama in 2010, aims to make health insurance and more affordable and accessible, and is also known as Obamacare. It expanded Medicaid eligibility, established health insurance marketplaces, and included provisions to protect consumers from abusive insurance practices. Key goals and provisions: expanded coverage, marketplace, and subsidiaries, Medicaid expansion, consumer protection, individual mandate. The impact and outcomes was to reduce uninsured rates, expanded access to care, protection for people with pre existing conditions, young adults covered. But there have been a lot of, throughout the years, disdain for this Affordable Care Act. And I am one of those people that have disdain for it. However, Judge, you are here to explain on how this whole thing came into conception and how it ended up passing through Congress and becoming law. So, hi.
Hi, that Obamacare Affordable Health Care Act of 2010 is one of the worst frauds that has been perpetrated on the American public. First off, Obama had nothing to do with it other than the fact that his Indonesian trust fund seems to have invested big money in Blue Cross and Blue Shield in 2008 and '09, and the connection between Blue Cross and the Affordable Care Act is the person that drafted it was Republican senior U.S. Senator from the state of Tennessee, Dr. Bill Frist. Dr. Bill Frist was also the Republican Senate Majority Leader in 2003 when he first tried to get the bill passed. His connection to the whole thing is his family founded Blue Cross, Blue Shield, and most of the HMOs and medical insurance companies. If they didn't found them, they have a connection with them from stock holdings and various interests that are exchanged. Now, affordable care builds on the Social Security setup, which came about in the early 1930s at the impetus of President Franklin Delano Roosevelt, FDR. There was a loophole that came in unintentionally that he wound up exploiting, and the flaw was never corrected because it had a convenient side effect. What that was is this: it is permissible as the Social Security Administration Act was originally formulated back in the 30s, and it still is, for the U.S. government to borrow against it. So what happens is the U.S. government has been in an almost 80-year-long history of borrowing against the Social Security funds for other purposes. FDR used that to help fund his New Deal. Most recently, we have had that expanded by Medicare and Medicaid as they've been modified so that the monies paid into those funds can be used for other things. And for the last 15 years, the money has been used to fund special programs dealing with certain agendas that I call the Rainbow Agenda. It's hooked up with this thing about pushing boys in bras and panties competing against girls in girls' sports, using the girls' toilet facilities and shower rooms. It's used for all sorts of things that the American public soundly rejected in the last election cycle. And it's poisonous. One other thing it does, having been drafted by Dr. Bill Frist, whose family founded Blue Cross, and which he now assists in the running of, it has enabled the medical insurance company to get even greater profits off of what they do to rip off the American public. The fundamental problem with it is that, in essence, instead of the money going to U.S. citizens, it goes to the medical health insurance industry. There are some things in there that make absolutely no sense when the government, since it's paying the money out, could pay it directly to healthcare providers, to pharmaceutical acquisitions and things like that. It does not, because what happens is the medical insurance industry is allowed to charge the customer the premium, get benefit of the customer's copay, and get an enormous reimbursement by the federal government for what they have paid out. And that does not need to be there, because all of the profit they need should come from what they get from the premiums they charge. Those premiums are substantially higher than the premiums that come from, say, when you have a general insurance company that also does medical insurance. The game is that the medical health insurance industry portrayed itself years ago as specializing in healthcare, and therefore in a position to give the American citizen who is needful of healthcare a better deal than he gets anywhere else. While that might have once been the case, it is not now, and they use this rep to rip the public off. They also find themselves getting a great deal of reimbursement by the federal government when they are involved in supplying generic drugs. The generic drug industry does not have to go through the expense of developing the drug, running the field test, maintaining the liability insurance on the level that the major pharmaceutical industry does. And they get the advantage of being subsidized by the government through affordable health care. And it is a horrible ripoff. And that has a great deal to do with why medical costs are so high. Physicians cannot prescribe the latest in healthcare for their patients because the patients can't afford it. And the healthcare that they get through Medicare, and as is necessary to make up for the fact that Part A and B and D and G aren't covered ordinarily under Medicare, but need other insurance carriers to handle, they can't afford it. Big Pharma is blamed, but that is a propaganda artifact of what the medical insurance industry is being done. Big pharmaceutical industries are not making the profits that the citizenry thinks they are making, because they're getting ripped off as well. The true culprit are those industries like Blue Cross, Blue Shield, Humana, and such like, and I call the names out, who rip the public off in terms of the extremely high fees that they charge for services that medical insurance acquired through ordinary insurance companies, in comparison, is much lower. So we need to get a handle on this. And Medicare is poisonous right now because of affordable health care, which was drafted by and pushed by Dr. Bill Frist when he was Senate Majority Leader. He introduced it in 2003 and repeatedly tried to get it through, but he couldn't until Obama's trust fund invested in it. And now we have Obamacare, which rips us off. You will find that there is a trap in the whole Medicare, Medicaid thing that kicks in when you hit retirement age. If you reach 62, you can apply for Social Security benefits. You can get them, but they will be much reduced. If you wait till 65, you'll get the full amount that you're entitled to. If you wait till 70, what happens is your Social Security benefits will be substantially greater in terms of the primary benefits. But when it comes to Medicare, what winds up happening is if you don't apply for it when you hit 65 because you have a group insurance plan or you have your own private plan and it is adequate to you, each year you delay past 65 will result in a penalty being assessed against you once you do apply for it. Now, a lot of these group plans will cut you off at 70 or 75 years old. And then you have to go to Medicare, in which case you're hit with a stiff penalty. Now, what happens with this is if you wait until you're 70 years old to apply for your Social Security benefits, you don't get any greater amount after 70, but you get a significantly higher amount if you wait till you're 70. But by then, you've got 5 years worth of penalties that build up against you because of Medicare and Medicaid as well. And what that's about is certain people want this huge reservoir of funds to be available to go in and raid for their special programs, their agendas that they have, social agendas, and things that most of us do not approve of. So what winds up happening is, let's say that you had a group insurance plan through your union that you keep through your, say, 70, 75 years old. What winds up happening is maybe you were paying $1,680, $2,130 a year for your group plan. By the time you get through paying the penalties with Medicare, and if you are not in that category of being flat broke busted, but you've got a good 401k that's in operation or a good retirement plan you've set up, you don't pay the $174 a month for Medicare, which is the primary fee, which, by the way, if you multiply it by 12, is going to be pretty close to what you were paying for your group insurance. But when the penalties attached to it, and if you are not at the very bottom of the income scale, with your increase in the increments of your monthly payments, you might wind up with the now increased co-pays and deductions that you have to take care of, that you secure alternative insurance to get Part B and Part G and Part D. You might wind up, instead of paying 1,800 something a year, 2,100 something a year, I mean, you might wind up paying $12,000, $14,000, $16,000 a year for Medicare. And that is just an absolute ripoff of the American public. It should not be allowed. It's criminal, and everybody involved needs to be pilloried about it. Now, that's what's going on with Medicare and Medicaid. And some states like Tennessee do not even have Medicaid because their states refuse to accept the payments. And this has been some years ago since this kind of situation developed. They called it, they did not want to promote socialized medicine. But it's a shame because the United States is either number 23 or number 28 in health care provided to its citizens in the world. And that is a shame for our country to be that low down the totem pole. Now, we need some change in it, and it's time. Maybe we need Doge to look at it so that we can cut off the fluff and get rid of the diversion of funds that is going on with Medicare, Medicaid, and such situations, and the effective huge subsidy that the U.S. government is paying to the medical insurance industry. Now, I'll say that that's basically my summation of the situation.
Of the Affordable Care Act?
The Affordable Care Act is one of the most poisonous frauds ever perpetrated on the American public.
Anything positive you could say about it?
Not one damn thing, because there are many ways to do it. And but for the inclusion of those people with pre-existing conditions, which simply, the way I read the act, was not so much out of concern for the people who were suffering from those pre-existing conditions, but as a basis for getting more money into the kitty that they can raid for other purposes. That's why the Social Security situation is as bad as it is because the U.S. government has been dipping into it and taking the money out with a so-called IOU to itself to put money back in at some undisclosed point in the future, which is not what's happening. And essentially, the whole thing has become a Ponzi scheme the way it's operating now.
I agree.
I know personally, a year and a half ago, through SAG-AFTRA, I'm still a union member, they pulled off a scam on the senior members. And they didn't notify us, as they were supposed to, that there was a class action attacking that. Well, the class action won, but by that time, they had given everybody an ultimatum. You had to go on Medicare. So with Blue Cross, Blue Shield being involved in this, Humana and some other things, which should not have been the insurance company that was doing the carriage anyway, they were involved in it. And what happened is that from paying $1,670 some a year for full group coverage, you wind up paying somewhere between $12,000 and $14,000 a year, which is what, 7-8 times what you were paying for group insurance. You're paying to be covered by Medicare and the next necessary insurance plans that you have to cover the 20% that Medicare doesn't cover. And I include ARP in that ripoff too, because even though they're supposed to deal with senior citizens, they're operating in that insurance industry as well, the medical insurance industry, and they're getting a substantial benefit from that. So a lot of seniors are using ARP to deal with their Part B, D, and G coverage.
DOJ filed statement of interest supporting equal access of education opportunities and facilities for Jewish UCLA students. So it says the federal task force to combat anti-Semitism announced today that the Justice Department has filed a statement of interest in Los Angeles federal court to advance the appropriate interpretation of federal laws that prohibit colleges and universities from discriminating against students because of their religion or national origin. This statement of interest filed Monday is part of a task force nationwide effort to combat anti-Semitism in all forms. So according to the allegations, Frankel versus Regents of the University of California in the spring of 2024, administrators of the University of California systems allowed members of a protest encampment to physically prevent University of California, Los Angeles students and faculty from accessing portions of the UCLA campus if they were wearing articles reflective of their Jewish faith or if they refused to denounce Israel.
That's got something that's more political than it is Title IX or Title VII. When I went to
let me just finish reading this part. The plaintiffs are Jewish students and Jewish professor at UCLA who allege the university knowingly acted in concert with or allowed members of the protest encampment to prevent them from accessing a central campus space and adjacent classrooms and library on the basis of their Jewish faith or national origin in violation of Title VI of the Civil Rights Act of 1964, the 14th Amendment's Equal Protection Clause, and California state law. The United States Statement of Interest addresses the significancy of plaintiffs' claim that defendant administrators violated Title VI and the Equal Protection Clause.
What that's about is they were having a little problem, if you recall, between Israel and the rest of Palestine. And there was a great deal of unrest about 3 years ago on the UCLA campus. Maybe it was 4. And that was the result of some edicts to keep down what they thought was going to be campus violence. I looked at it and I kind of laughed about it because I remember the scenes on campus when I was there back in the 1960s. Now, when I was at UCLA as an undergrad and then at law school, I would say at least a third of the professors or the staff and faculty were Jewish. If you saw somebody white on campus, likely as not, they were Jewish. And they were not in a position of being, shall we say, much of a minority on campus. So I guess that situation has changed, and I guess the students have gotten a lot more passive than they used to be. I know that white, black, brown, red, yellow, that kind of acquiescence in somebody telling you where you could and could not go would not have been tolerated in the late mid-60s. Say from 64 up until the 60s were done, that just would not have gone. But there's so much meeker and milder now, the students that we have in our schools, and they are all off into entitlements and such like, and they're weak and they feel that they've been set upon, so they go to court.
Yeah, because it says the department has also announced an investigation into the University of California to access whether the university system engaged in a pattern or practice of discrimination based on race, religion, and national origin against its professors, staff, and employees by allowing anti-Semitic hostile work environment to exist on the campuses, including UCLA.
I'm embarrassed all to hell because when I went there, it was encouraged to develop hostilities if necessary so you could see what was there and oppose it or at least learn about it by seeing it in opposition. Now they're so damn weak and entitled that they have to be babied. I guess they can't protect themselves anymore. I don't get it. I think that's a horrendous statement of weakness.
It says
and by the way, they're going to run into a problem that is only obscure because nobody raises it. It's what the California Constitution says about the University of California and its obligation to pursue leadership in the various cultural and ethnic and racial groups that constitute the population of California, with academics being secondary. So I find it interesting that they've completely forgotten the specifications that are actually in the California state constitution as it pertains to setting up the University of California. And this dates back to 1851, wherein 170 years ago, this was how the University of California got set up as contrasted to the state college system, which is now the state university system.
So it says the task force also recently announced that the department, together with other federal agencies, will cancel $400 million in federal contracts and grants to Columbia University due to the school's inaction in the face of persistent harassment of Jewish students. So basically, if students, I guess the Palestinian students who were protesting what was going on in Gaza, you mean to tell me they can't protest? And if you protest, it's anti-Semitism?
This started under the Biden administration, and it's another example of encroaching on free speech. See, in other words,
well, Pam Bondi is the one that's leading this.
I know she inherits this stuff, but see, the problem that is so bad is whereas the Jewish population has a right to protest, the Palestinian population has a right to protest, freedom of speech, you have a right to assemble and petition for redress of grievance. And as long as you're not dealing with, as the Supreme Court has said many times, pornography, slut, obscenity, there is no restriction on free ideas as long as you do not, in fact, promote or incite public violence or cause it. So I'm not used to this kind of thing. I'm used to the students in America and elsewhere around the world sort of taking matters into their own hands, which seems to no longer be the case. And by that, it's a good thing. It's a civic responsibility thing. It's a learning thing to find out that you do have power. Now, we had an exemplar of that where we had Black Lives Matter and such like, and this George Floyd nonsense going on where people were just pimping the public and burning stuff down to make a point. We had Democratic elected officials bailing out some of the offenders who had been locked up for arson, rioting, looting, and such like, including their presidential candidate, Kamala Harris, who participated in raising a fund to bail the miscreants out, who continuously repeated their offenses night after night. That kind of thing, I guess, has become on one side, and then passivity is on the other. And depending upon what the agenda is, I guess it mixes. Nobody's got a middle of the road position, but everybody feels either helpless or enraged. And we get this, we promote you being helpless, or we promote you being in an out of control rage. So that does not speak well.
All right. Good night, everybody. See you in the next video.